Hi, I'm Latricia, and I'm your clinician today. I'll be doing your musculoskeletal neck and spine exam. And your name is?
JS.
And your date of birth?
46.
How old are you? I'm sorry. And we're uploading this video for grading purposes, and it'll be uploaded on YouTube. I would like for you to verbalize consent that it's okay for me to upload this video for grading purposes.
Yes.
All right, so we will start off with your musculoskeletal exam. Right now, I'm just examining and inspecting your head, your neck, and then just looking over your elbow and your hands, okay?
Okay.
So I'll start off just inspecting your neck for symmetry and just checking. Just make sure that there's no nodules, no rashes or lumps or anything, okay? And then I will go into palpating. So first I will start off with your hands. As I inspect your hands, I'm just going to palpate and check for any knots along your wrist. And then I'll do it both hands. I'll be doing both sides of the exam.
Okay.
All right, and so as I palpate your hands, next I will be doing a range of motion. So first I want to start off with abduction and adduction. So your abduction, I'm going to, ab is take away, so I'm going to spread your fingers apart from each other. And no tenderness noted, correct?
Correct.
All right, so again, I'll be doing both hands, and this is just your abduction. And then I'll do adduction, where I'll put your fingers together. Perfect. Any tenderness?
No.
All right, so I'm going to go ahead and have you ball your fists up. And then we're going to do flatten on your wrist. So you're going to extend and flatten up. Perfect. Extension and flatten. All righty. So we're going to do abduction and abduction again with the wrist. You're going to turn your wrist outward, which is abduction, and then inward, very good, which is adduction. And the same on your right. In is your add, and then your abduction. Perfect. So now I'm going to have you relax. All right, so then I'm going to do a specialty test where checking for corporal tone. We're going to do a Fallon test where you place your hands as if you was praying, like this. There you go. And then upward, and then just press them together. Any pain?
No.
All right. And then your next one, you can relax. I'm going to have you do the Teno test, where I'm going to check your corporal tone, where I'm going to bend your wrist and just press right here, palpate right here on your corporal tone. Do you feel any pain or anything?
No.
All right. So this is your Teno test, and then we'll do the same thing here. Perfect. All right, so next I'm just going to inspect your elbow. So I'm just looking and checking for any lumps or any bruises or any swellness or any redness. Okay, so then I will palpate your elbow. So again, just checking for lumps or bruises. I'm checking your Ocanion process, and then it's right here. So you have your medial is inward, and then your lateral is outward, your epicondyle area, okay? Then same here, your medial, and then your lateral. Perfect. And I'm just palpating. Next, we'll be doing a range of motion. So with the range of motion of your elbow, I'm gonna have you bring your abduction extension, like bring your arm in and then bring your arm out. That is your abduction, and then your induction. And then we're going to do your right, the same thing. Perfect. Thank you. And then out. Perfect. All right. So next, I'm going to have you stand up for me. So you can stand this away. So basically, I'm going to have you raise your hands up for me. So what I'm going to have you do is, can you lift your hand behind your back? There you go, and scratch for me. And then bring it down and touch your, there you go, your scalpel. And then you're going to do your right side as well. Perfect. There you go. Perfect. And then while you do that, I'm going to also have you, while you're standing here, I'm just going to also have you do a range of motion where you take your arm and you're gonna abduct and adduct inward. There you go. And then outward, bring your arm out. Perfect. And do the same for your left, inward. And I'm just checking for symmetry. Also checking your shoulders as well and your elbow, and then outward. Perfect. Then we're gonna do the drop test where you raise your hand up, but then slowly bring your hand down. Okay, so while you do that, I'm gonna be standing behind you, and then I'm gonna raise your hand up, but then bring your hand, I'm gonna raise your hand up and then bring your hand slowly down. I was standing behind you, I'm sorry. And then we're gonna do this side, bring your hand up, and then bring your hand slowly down. Perfect, as I press backwards. And while you're standing, I'm gonna go ahead and I'm gonna check your neck. So I'm just checking right now, I'm inspecting, and I'm just checking for any lumps or any nodules that could be noted, okay? But then I will palpate starting from your supraclavicle area, and then I will go down. Perfect. And then as I check, I'm just checking the notch right here, which is your bicipital groove. So I'm just checking right in here is your bicipital groove, and I'm just palpating with my thumb. Alrighty. So then I will have you do me a favor, and then I will have you turn your nape. Can you back up some? There you go. Turn your nape to your right, and then turn your nape to your left. Can you bring your chin down for me? And then can you bring your chin up? Perfect. So you flexion and then you extension. Very good. And then can you do a circular motion for me? And then go the opposite way. Perfect. Thank you. And then we can also do, if I wanted to check, we could do a near test to just check where I'll place my hand on your shoulder, shoulder, and raise your hand up and try to bring it back. Any tenderness noted?
No.
Any pain? All right, and then we'll do this side as well. And then down. Perfect. All righty. So now, while I have you standing, I'm gonna have checking your spine, and I'm just inspecting your spine. Okay. You turn this away, and then I'm just checking, and then I will palpate your spine. Can you bend down, touch your knees? And then can you touch your feet? So there you go. And then I'm just checking, and I'm starting from your C7, and then I'm gonna work my way down. Perfect. And then I go all the way down, and then right here at your iliacs, there's some dimples. You can stand up for me, and then I will press in and just check your hip and just check in and make sure that there's symmetry and that your legs are equally proportioned, okay?
Okay.
So, alrighty. So can you do me a favor, and can you twist to your side, to your right? And then can you twist to your left? Perfect. And can you bend backwards? And then I'm just checking your spine for scoliosis or checking for any lordosis or anything. And is there any pain?
No.
Alrighty. So then we will have a seat for me. So I started off with your, a little bit over for me so I can stand in camera. So I started off with your neck, and then we checked, and you did the range of motions. We did your shoulders, where you did your abduction and your induction, and abduction and adduction, and then we did your flexion and your extension. So now we're gonna move on to your hips. So I will have you lay back for me. And so now I'm gonna have you where I raise your right leg up. So I'm gonna raise it up, and you tell me. I'm gonna raise it as high as you can go. Is that good?
Yes.
All right, any pain or anything?
No.
All right, and then I will bring it down. And then I'll do the same thing for your left leg. I will raise it up, and then I will bring it down. Perfect. And then next, I will have you move over to your side. There you go. And then I will shake your trocar, your greater trocar area, which is your hip bone right here, your trochanter area. And I'm just palpating, and we'll turn to the other side and I do the same thing. Perfect. And just palpating this area here, which is your gradient trochanter, which is that bone right here at the tip, okay? Perfect. And then I'm gonna have you, bend your knee, and then I'm gonna take your leg, and then I'm gonna adduct your leg all the way to the other side, and then I'm gonna take it and then abduction away. Perfect. And I'm just checking again your hip. We're gonna do the same thing for here, and then we're going to go adduction, and then we're gonna go abduction. Perfect. Let's see if I can bring your leg. There you go. And then I'm gonna press downward. Perfect. Thank you. And we'll do this same thing. Any discomfort, any tenderness?
No, ma'am.
Alrighty, thank you. Next, I'm gonna have you sit up for me. And then I'm just gonna inspect your knees, and I'm just looking for symmetry again, any swollenness, any fluid in the knees, or any redness in the knees, okay? And then I will move forward with palpating. So I'm gonna just palpate your knees, your patella, your meniscus groove is right here. And I'm just palpating in your medial and your lateral of your patella. And your meniscus groove is right here. So as I palpate, and then if I wanted to know if you had like a Baker cyst, I will press in the back of your knee, and I will check in if I felt something, you know, but you're good. Perfect. And I'm just perfect. So next we'll do range of motion with your knee. So I'm gonna have you lay down, and then I will sit on your knee, and then I will press inward on your knee, and I'm just shaking, I'm just palpating, and I'm just shaking your patella. All right? Okay. And then I'm just pushing forward with my thumbs, pressing onto your knee. Perfect. And then I will do the same for this. Sit on your knee, and then I'm just checking your calcaneus. I'm sorry, not your calcaneus, because that's your heel. I'm just checking your patella and just pressing down on it, okay? Okay. Perfect. Do they feel any tenderness?
No.
Your tibia and your fibula area. As I do the range of motion of your knee, I'm gonna flex your knee in, and then you will turn over on your stomach for me, and then you can turn over on your stomach for me. And then the extension is being able to bring your knee, bend it backwards. And then we're gonna go ahead and do it since you're already on your belly for this leg, and then we'll turn over. And while you're over, I'm sorry, sir, while you're over, I'm gonna go ahead and palpate right between your cheekbones, your area right here, as I examine your hips. All right, perfect. Then we're gonna turn you over, sir. And again, we're gonna flex your knee, and then we already did the extension part. We did the flexing from behind. Perfect. All right, so you can sit up for me. Next, I'm gonna check your ankle, and I'm just inspecting again for any swellness, any redness, or any discoloration, any tenderness, any knots or nodules, okay? And then I will palpate your interior, your posterior, your lateral, your medial side of your ankle. Perfect. No swelling noted. Perfect. And then we'll do some range of motion where it is adduction and abduction. So add inward and ab outward, okay? And then we can flex downward, and then we're gonna flex upward. Perfect. And the same on this side, we're gonna do inward, internal, and then external, and then flex. Very good, an extension. And then I'm just shaking your toes, and then the bottom, the calcaneus now is the heel, and I'm just shaking for those areas as well. I'm sorry. Perfect. Alrighty. So can you stand up for me? And I'm just shaking. Does it hurt while you stand because you're standing flat on your? Okay. Perfect. So basically, we're pretty much done with your exam. So thank you and appreciate you.
Thank you.
Alrighty. I will close it.